You're watching Ketome TV. Knowledge is power.
Do certain blood pressure medications increase the chances of lung cancer?
That is a good question. It's multifaceted too.
Mm.
Was this specific to lung cancer?
The question from Gerald,
Yeah.
which is all the information I have, is
Yeah.
do certain blood pressure medications increase the chances of lung cancer?
Right. Okay. So there was a study or a few studies that showed that popular medications called ACE inhibitors, angiotensin converting enzyme inhibitors, also known as ACE inhibitors, would increase the risk of lung cancer. The increase is about 15%, if I recall. But one of the common side effects of these drugs is that they do cause a dry cough. Now, what the mechanism of this is that there's a protein called bradykinin. And these ACE inhibitors have a side effect that they tend to increase the amount of the bradykinin protein in the lungs. And that results in a slight cancerous effect or increase in risk in cancer.
But what's the cough about?
So that's the buildup of the bradykinin.
Oh, I see.
Yeah.
Okay.
It kind of plugs things up.
And that is from blood pressure, some blood pressure
They're called ACE
medications,
inhibitors,
some
yes.
ACE
So
inhibitors.
what they recommend you do is you go to an ARB inhibitor. So the ACE inhibitors block the enzyme, the angiotensin converting enzyme, and the ARB inhibitors block the receptor. So it's a much better job to block the receptor than the actual enzyme itself.
So ideally, we would start on the ARB?
Yeah, I think most doctors are switching patients who are on ACE inhibitors to ARB inhibitors now.
Okay.
They're better drugs. They seem to work a little better, a little more costly, I'm sure, but there's a whole class of ARBs now.
Okay.
There was some issue with ARBs being contaminated, and there was an FDA recall, but there's a few different brands, and it didn't affect all the brands.
Okay. So if you are either on an ACE inhibitor or your doctor is talking about putting you on some blood pressure medication and you want to reduce the risk of developing lung cancer, asking for the ARB inhibitor would be one way to go.
Now, there is another consideration here. So obviously they increase the risk of lung cancer, but they can decrease the risk of other cancers. And the reason they do that, ACE inhibitors tend to reduce testosterone in circulating testosterone, free circulating testosterone. And testosterone has basically been the scourge of mankind, as we all know. It's the male hormone that causes in females too, but it causes aggressiveness and aggressive behavior. It can too much of it can cause prostate cancer. It causes plaque buildup, and I mean we're all aware of the effects of steroid rage, where bodybuilders who take too much testosterone, just lose it and, sometimes commit murders and do all kinds of crazy things. And we are also seeing a lot of different cancers in these bodybuilders, and heart attacks at young ages and strokes. So, testosterone is something that it's good in a very small dose, and it can build muscle, which is important. But, in a lot of people, they can have too much testosterone.
So are you saying the blood pressure medications reduce your testosterone?
Yes, they do, yeah.
Okay, so that's kind of a positive side effect.
Positive side effect, you
depending on how
develop
much of
less
a reduction.
muscle, and depends if you want the effects of testosterone or not.
I see.
I mean, a lot of men are getting testosterone replacement therapy now.
Right, sure.
It makes them feel, younger and stronger, and they can build more muscle and so on. So there's a benefit to that. I think with most things, it's like having a perfect balance. But in things like prostate cancer risk and so on, ACE inhibitors actually reduce the risk of prostate cancer. While they may increase the risk of lung cancer, they decrease the risk of other cancers, and they also greatly. So testosterone can cause heart attacks by increasing plaque in your arteries. That's one of the bad side effects that they have. So they increase heart attacks and stroke and so on.
So what is known about those ARB inhibitors you were recommending in contrast to do with the testosterone? Do they also reduce the testosterone
I'm
in the
not
same way?
so sure of that effect. I know the ACE inhibitors do. I haven't looked into the ARBs, to be honest.
All right. You'll do that, I'm sure, and
probably
follow
will.
up with us.
There's also other classes of heart medications called beta blockers. Common one is propranolol. And that actually has shown to be effective in certain cancers that express the beta adrenergic receptor. Certain cancers, for example, like angiosarcomas that are really hard to treat. There's been cases where these drugs have had remarkable responses in patients with angiosarcomas.
Well, that's interesting.
And other cancers that express those receptors. So, heart medications can be beneficial too as well. It's a give and take situation.
Okay.
Sorry if that was a long-winded
That was
answer.
rather, but very informative. So generally, Gerald, ACE inhibitors, yes, have some data that show that they do potentially increase the
Depending
chance
on
of
what
lung cancer.
you're concerned about.
Yeah, it was lung cancer he was
Lung
specifically
cancer,
asking about. Yeah.
Thank you for watching Ketone TV. Subscribe below and stay informed.